take a deep breath, take the higher road. That's what they always say, as if they know the way. They won't take it from me. But don't ever doubt yourself, 'cause life ain't just a dream. You make your own, so kick and scream. The people will act with a never-ending force. You never had the chance, so what you waiting for? The day has come, my friend, 'cause this is war. It's time and this is war.
Hello and welcome to another edition of Nurses Out Loud Q&A with the nurses. I'm your host, Nurse Kimberly Overton, and I am joined today by Nurse Jodi and Nurse David. Together, we are here to answer your burning questions, address your comments, and provide the support that you need on your healthcare journey. This is your chance to be a part of the conversation. Each episode, we feature your questions and comments, tackling the topics that matter most to you. From career advice to self-care tips, we are here to empower and uplift our community. So send us your questions, share your experiences, and let us know what you want us to discuss. We are here to create a space where we can all learn, grow, and thrive. Remember, this is not just about us sharing our knowledge or our opinions. We want to hear from you. Your voice matters and your experiences are valuable. So send in those emails to nurses@americaoutloud.com. We will be featuring these questions and comments every Friday on this special Q&A episode with the nurses. We encourage all of you to engage in the battle and find your voice in this fight. But until you are able to do that, we will continue to be that voice for you. All right, Nurse Jodi, Nurse David, thank you guys for being here with me today.
Thank you. Happy to be here.
Same.
Absolutely.
Always fun.
Oh, it's always an experience to me, especially with you, Jodi.
Yeah, especially with the two of us together.
Well, Jodi, I'm glad that you're here with us today for this particular episode. You covered a pretty controversial topic, right? And
Which one?
That doesn't narrow it down yet.
True enough.
Right.
You covered a pretty controversial topic, Ozempic, and our listeners have responded. They have responded. So we've got a couple of emails that I'm going to go ahead and read, and I'm going to give you an opportunity to respond to the concerns of the listeners. So the first one is from Cindy, and Cindy says, "Hi, Nurses Out Loud and Nurse Jodi. I was appalled when I heard Jodi having a host on who claimed Ozempic had all kinds of health benefits. The podcast started out as I had expected, telling how harmful and toxic Ozempic is, but I couldn't believe it when Jodi's host was trying to flip the narrative on Ozempic, and Jodi agreed with her, and that she is now taking it in lower doses. I'm a nurse as well, and I admire all the nurses on Nurses Out Loud, as well as the doctors on Looking for Healing Radio. I tune in often to both podcasts to hear the truth about the harm of pharmaceuticals and also to learn natural ways to achieve healing. This is the first time I've seen such an inconsistency between the two shows. Often both shows are covering the same topics at some point, but the main point is that both shows uncover the evils of the pharmaceutical industry and teach of natural remedies and supplements to use instead. Dr. Artis has many podcasts telling us about the harms of Ozempic and similar types and exposes how it is being derived from the Gila monster venom. Surely you've heard Dr. Artis talking about all of the horrendous side effects and how they don't go away even a year and a half after stopping this so-called medicine. It makes perfect sense that the side effects do not go away because toxins are stored in the fat, and that's exactly where these types of medicines are injected. Of course, all of the side effects are listed on the television ads. Regards, Nurse Cindy. Now, Jodi, do you want me to read the second question as well, since it's the same topic, or
No, we can break it down.
Okay.
Okay, so first of all, the episode that she's referring to is called Ozempic. The Poison is in the Dose with Dr. Tina Moore. And this show, we did talk about the misinformation, if you will, okay, or what's publicized out there in, our meta universe, if you call it, right? So first, I will have to say thank you for your thoughtful response and giving me an opportunity to respond. I am a practicing ER nurse, and I will tell you, I see people regularly come in with side effects. And I've also seen a lot of people do very well with it. Okay. And so I came at a crossroad. She wants to talk about Dr. Artis. Dr. Artis is a good friend of mine. I love and admire and respect his research and what he found about, the venom being in, part of the makeup, I guess, of Ozempic. He also talks about how the venom is in lisinopril, which is a widely used medication to treat hypertension. Now, having said that, I'm also not the type of person or nurse to just follow one narrative. Okay. Now, granted, what I was seeing in the hospital were horrific cases of people with intractable nausea and vomiting and backed up, I think one patient I've seen had a small bowel obstruction. They had so much fecal matter in their colon and they weren't, releasing it. And so, but then I also have very, very good friends of mine that it has changed their life. Now, Dr. Tina Moore, I started following her back in 2020 because she was speaking out on the whole COVID narrative. And at that time, I was just, looking for anyone that, had some research and, were using the medications in their practice because I didn't want to keep just telling people we're not treating, go home, but there's nothing we can do when there were courageous, educated doctors out there doing it. And so following Dr. Tina on Instagram, I was seeing reels that she would post about Ozempic and what she was uncovering. And it's not just Ozempic, guys. We're talking about GLP-1 peptides, okay? They're not even a form of medication. They're not medicine. They are peptides. But you do need a prescription to get them. And because I respected her and her research and her practice, I, was like, okay, you know what? Instead of just keep seeing this, because she was actually calling out influencers and saying, I wish that these nurses that are out there influencing the public would look at this research. And then I thought, okay, well, I'm going to look at it. And then I did. And what I uncovered was what I believe to be the poison is in the dose, as the title of the show suggests. And so anybody that's listening to the show without an open mind, without doing the research, without clicking on the link and getting access to the videos, I think that's just an ignorant stance because, are you going to come at Dr. McCullough? I mean, I'm sure you respect Dr. McCullough because just yesterday on my drive to work, I listened to his podcast with Neo 7 Bioscience, and it's called Personalized Peptides for Cancer Patients Provide New Hope with Targeted Therapeutics. Now, if you go on to Neo 7, number 7, Bioscience, you will find on the front page of there, they say that they specialize in the development of personalized peptides designed for patients with active diseases, including cancer, autoimmune, neurodegenerative, viral and environmental, as well as patients seeking to prevent disease and enhance longevity. If you listen to that episode that I did with Dr. Tina, you will hear that that's exactly what she did. She started her research off of typing in heart peptides, lung peptides, kidney peptides. And what she uncovered was this body of evidence of how revolutionary these peptides are. Now, again, when I talked about microdosing them, this is different than getting a syringe with a pre-filled unit and, doing it like, everybody is doing it. Here, take this 25 units first week, up at, 5 units the next week. No, it's more specialized. And it's also included with having a diet that is focused on protein and weightlifting. So I don't know. Do your research, and then maybe you'll understand a little bit more about why I do support the peptides. Listen to Dr. McCullough's episode. Check out the website because they're helping vaccine injured people. So I don't know.
And I think that's important to note. Like, we do have great respect for Dr. Artis. We have great respect for Dr. McCullough. I love Dr. McCullough. I don't always agree with Dr. McCullough all the time. I don't, and that's okay. It's okay if I don't agree with you, if you don't. But you're right, and what you addressed in the beginning is that we can't only listen to one side of the narrative, one side of the story. We've got to be able to take all of the evidence, all of the research into consideration. And at the end of the day, we all make our own decisions based on the research that we have available to us. We can make the decision if that's something that we want to take for ourselves, or if we don't feel comfortable with it. But
and to educate the public, right? We know so many people are on this.
Yes.
And if there's a better way to do it, people that are having chronic pain, they're not having chronic pain anymore. Inflammation is gone in their body. People, losing weight is just one of the benefits. But again, I'm not doing it like everybody else is doing it. It's more of a micro dosing, and I'm working very closely with the practitioner that is specialized in this and incorporating those other lifestyle changes that I had talked about. But yeah, it's, we have a platform, and when we know that a vast majority are either on it, considering it, you want to give them the best education or another form of education and research that they can look into it further and decide if it's right for them.
Right, because a lot of people, like you said, a lot of people are going to take it. A lot of people are trying to lose weight. Oh, it's very difficult. Don't even get me started on the menopause thing.
Right.
We've got to address that, but it's an issue for people, and a lot of people feel like it is a last ditch effort, and they're going to, like you said, they're going to do it anyway. If there's a better way and we can provide them with that information, then we should absolutely do that. So I do agree with you there.
That was
let's hear what. Oh, go ahead, David.
I was going to say that was a very thoughtful and nuanced question from Cindy. So thank you for that, Cindy. And for me, as somebody who's kind of ignorant, I've never done a deep dive on the GLP-1 peptides, but I've seen these kind of red flags that remind me of past pharma scandals, like the profits that they are projected to have around these medications are absolutely astronomical. And that's always something where you should have your radar up for predatory behavior. But, when you look at past scandals like Vioxx and like OxyContin, and those are medications that I dump on all the time. Vioxx is a really effective medication for pain control. So is OxyContin. The problem with them is that they lied about the side effects in order to profit off of people. I think it would have been great if Merck was transparent about the cardiac side effects of Vioxx so that they they wouldn't have made the profits that they made, but they could have given it to people and then monitored them and both controlled their pain and guarded them from fatal side effects. But instead, they decided to lie about the side effects to make a quick buck. Same thing with OxyContin. The same thing sort of happens with SSRIs. Like a lot of these medications do have their place. The problem is when we don't have actual transparency and we don't have informed consent. That's what's missing. That's what I'm worried is missing with the GLP-1 agonists is informed consent, that we don't have the full picture of what the long-term side effects might be. But that being said, these might be very powerfully beneficial to the right person. It's just about informed consent. Do doctors know what they need to know about them? Does the public know what they need to know about them? I just have this inkling that things are going to come out over time that are being withheld from us currently because they might interfere with profits. But like
I
you
agree
said,
with you 100%. I agree with you on that. I believe that we are going to see lawsuits with the Ozempic and Wegovy and all of that, because it's the same thing what they did, David, with the OxyContin. They created this marketing campaign,
right,
essentially, right? And then word of mouth spread. Hey, I'm taking this pill. They said that it's not toxic or habit forming, right?
5% addictive is what they told people. Yeah, 5%,
Yeah.
5% of people will get addicted to this, and they knew that was a lie.
And they knew that was a lie. And then word of mouth spread. And now they're telling their neighbor. Now everybody in the neighborhood and the community is all addicted to OxyContin. And now
Right.
they're stealing and they're pillaging and they're doing all these things. I like the analogy because it probably is going to be the same thing. We have, people that are losing weight on it. And now you tell everybody that, you're losing weight, and then your neighbor's on it. Well, yes, there are side effects to every medication, but now you have now you have providers, nurse practitioners, PAs, doctors that see this as a moneymaker.
Yep.
Because, like, for example, I paid to see my doctor and establish care. I paid $400 to be with her for 90 minutes. Okay. But she's my primary doctor now. So it was a whole H&P history, deep dive into my life. And then she ordered the medication, which I dispense on my own, and I got it from a compound pharmacy. For a 12-week supply, I'm paying $250. These other, people that are having these practices just focused on weight loss and Ozempic, they're charging between $400 and $600 a month.
Yeah.
Right. So yes, there is a big money maker. The informed consent and the side effects, I'm sure, are not they're not looking into that, or people don't care. They're like, I'll take my chances.
Right.
And I wasn't willing to take my chances with that because I saw how many people came in the ED. I mean, a whole community of people are on it. So almost every shift I worked, I saw somebody. But again, when I looked critically at that patient, number one, they were already in a high risk category, morbidly obese. They were diabetic. So now their vasculature is already compromised.
Mhm.
Like they are not only, they're the perfect candidate for the perfect storm. And then again, now we're talking about the dose. When I found out on their intake what their doses were, they were at 60, 70 units. This is not microdosing, right? So very different, Cindy, very different.
Yeah, I completely get what you're saying, Jodi. And unfortunately, like to your point, David, I think we are going to see things like we saw with the Vioxx and with the other medications that they have tried to push. The pharmaceutical industry, they're not going to change anytime soon. I think that they've overplayed their hands since 2020. I think a lot more people are awake and aware of what they are, and I'm grateful that more people see them for what they are. But as you said earlier, medication does have its place, and it does sometimes help.
Yeah.
So we have to just to be discerning. We have to be discerning.
Right. And work with a provider that are not incentivized through big pharma. That's why I pay out of pocket for my functional doctor,
Many people don't realize that many providers are financially incentivized to use different medications. And I talked about that. I think it was in a Facebook post or tweet, or I can't remember what it was, but somebody disagreed with me. And I think sometimes it doesn't trickle down to those smaller private practices, but it's more in those corporate settings where you're going to see that sort of thing occurring. And it's typically at a higher level because we all know that hospitals were being incentivized to use remdesivir. That was part of the deal. If you don't follow those exactly, then you don't get reimbursed at the maximum rate.
Yeah, exactly. In early 2020, our hospitals nationwide were losing $50 billion a month until CMS and the federal government came out with incentives to use remdesivir and to ventilate people. And then all of a sudden, hospitals were making record profits. And we have fewer doctors than ever before who are practicing in private practice. Over the course of COVID, we went from about half of doctors working for giant corporations to now it's about 70% of doctors work for giant corporations. And those corporations, I mean, even when a hospital is technically a nonprofit, that's the bottom line is they want to make money.
Exactly. And unfortunately, these doctors, I've said it so many times, it's like they sell their soul for that guaranteed salary for, a couple of years. And, you almost can't blame them. They come out of school, they have all of these loans, they guarantee them their salary. And then after that, of course, it's on productivity. And that's where you get into the doctors and their, 5 to 7 minute visits, because the more patients that they're able to see, the more revenue they're able to generate, the higher their salary is. And it's really the absolute death of healthcare, if you ask me. So I am very happy to see some doctors breaking away and going the more, direct primary care route. And I think that's the way medicine needs to go entirely.
Yeah, they also sell their right to free speech because when you're a doctor who works for a giant corporation, you are contractually obligated not to dispute anything your corporation says publicly. I saw that in my hometown when our hospital was under a mandate and all these people had their jobs on the chopping block. We had a multitude of doctors who were upset about the situation, who were adamantly opposed to the mandates, and none of them could speak publicly about it because they were contractually obligated to stay silent. And at that point in time, we had these headlines that were just rubbed in our face. 95% of doctors have taken the COVID vaccines. And the implication was, if you haven't taken it, you're a stupid anti-vaxxer. And now we're at a point where it's only about 20 to 30% of doctors got the latest booster. We know that from information released by the Cleveland Clinic and from the NHS over in the UK, two of the only places who still release data like booster uptake. So now I would say if you're one of the people who's boosted, you're the conspiracy theorist because 70 to 80% of doctors disagree with you.
There you go.
And you published a really great article. Was it on your Substack? You published a great article. No, it was on America Out Loud.
It was, yeah.
An article on this. And so I will link back to that in the show notes because that was a really excellent piece. Yeah. Wow.
Did we have another question?
We have another comment about the
comment. No question.
Hi, this isn't really a question. This is from Barb. This isn't really a question, just a statement on Monday's show. Are you aware of what is in semaglutide drugs? Venom. So why didn't you mention this on your show so that the public would have this information before deciding to put venom in their bodies? I recommend you listen to the podcast from Looking for Healing Radio from Friday, July 12th, Dr. Jana Schmidt. It's all explained in this episode. Hoping this was just an oversight on your part and that you haven't been bought out by the big drug companies. Because I really enjoy listening to
bought out. Oh my gosh. I just picked up like 15 shifts this month.
Yeah, if you guys are getting hooked up by Merck or Pfizer, you need to let me in on it because
And my bank account will say otherwise, I'll tell you that.
Oh, same. No, we actually volunteer our time for this show. What's her name? Barb?
Barb. Mhm.
Yes, Barb. No, this is all our time, and we enjoy bringing you research and education. Now, yes, I did know about Dr. Artis had talked about that snake venom was in the Ozempic, and it paralyzes the stomach so that it delays gastric emptying. So it slows down gastric motility. Yes, I did know about that. That is why you have the effect of feeling full longer, because it's delaying it going into the colon, and it just slows it down. So you eat less, it fills you up, and then it stays there for longer than normal. And he said it was because of the venom. Now, I brought on a guest who was presenting her research. So again, that's what I do. I could bring on opposing views and let people decide. It sounds like you, Barb, like you listen to different shows and you develop your own opinion, which is great. That's actually what I hope people do with Nurses Out Loud is we bring you some interviews, research, education, and you just add that to your library and you develop your own opinion. But yeah, thank you for sending in your comment. I appreciate it.
All right. Well, Jodi, thank you for responding. Hopefully that answers the question and clears up any assumption that Jodi is bought and paid for big pharma. I promise
No.
you that is not the case. And then we do have another question from Tim. Tim says there is a lot of conspiracy theorists out there, but a lot of these theories seem to be coming true. How do we navigate this space to where we can separate what is true and what is actually a conspiracy theory?
Ooh, that's a good one. I would love to kind of unpack how I look at politics and other things through the lens of what I've learned in my career as a nurse looking at pharma scandals. It'll take me a little while though. Do we have time to dive into it right now?
Yeah, let's see. I think we've got, well, no, you know what? Let's come back after the break. I thought we had time, but now we're getting kind of close since it'll take so much time to unpack. So we'll hit that after the break when we
Okay.
get back. Okay.
Sounds good.
That sounds good. All right. Well, America Out Loud Talk Radio plays on the iHeartRadio network. You can also listen on our media player from any web browser anywhere in the world. We have the best in-class apps available on Apple, Android, or Alexa 24/7. Great Talk Radio. All of our shows go to podcast the following day. You can hear them on apps such as Spotify, Stitcher, Pandora, iHeart Podcasts, and many more. Be sure to subscribe and rate the show on Apple Podcasts for us. Don't forget to check out our online store at americaoutloud.shop, where you can find all of the products that we represent on our network at a discounted rate, including an incredible line of products from Chemical Free Body. Their 100% herbal formulations are based on thousands of years of biological system science. Unlike the majority of supplements you'll find on the market, with Chemical Free Body, you won't have to worry about harmful ingredients, binders, fillers, or flow agents. Their ultra-safe breakthrough nanosilver technology destroys pathogens, balances the microbiome, and boosts immunity. All of these products are proudly made in the USA and are backed by an unheard of double your money back guarantee. I've made a twice daily Green 85 drink part of my routine, which has led to a decrease in belly bloat and an increase in my energy throughout the day. Use promo code OUTLOUD to save 20% off the Healthy Gut Bundle. I'll catch you on the other side of this break. Stay with us.
It's time and this is what
Is your gut a mess? 2/3 of Americans suffer because of gastrointestinal issues, and I was one of them. That is why we created a 3-step, doctor-formulated, completely natural gut reboot system that you can do at home in just minutes a day. Go to chemicalfreebody.com/outloud today. Get the Malcolm Healthy Gut Bundle, reboot your gut and your energy, and save 20% on your first order.
Trouble getting to sleep and staying asleep is infuriating. Your mind races, you toss and turn. Nutrition company Healthy Cell created REM sleep to help you quickly fall asleep, stay asleep, and sleep deep. Unlike other supplements that don't work, REM sleep is not a pill. It's a gel you swallow with ultra-absorption of science-backed ingredients supporting all 4 stages of sleep. Go to healthycell.com and use code OUTLOUD for 25% off your first order. Risk-free. Love it or your money back. Guaranteed. Healthycell.com. Code OUTLOUD.
World-class care from doctors you can trust, all from the comfort of your home. That is One Wellness. Dr. Peter McCullough and his team at The Wellness Company designed the One Wellness membership to provide free monthly supplements and unlimited telemedicine access with doctors that share your values. Go to OutLoudCare.com today and use code OUTLOUD for 25% off your first month of One Wellness.
Many voices, one freedom, united in the First Amendment. Our goal is to herald the voice of genuine liberty at AmericaOutloud.news, a place where you'll find the naked truth expressed with a patriotic heart. Now is our time, my fellow Americans. America Out Loud Talk Radio. Liberty and justice for all.
Welcome back to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. Wherever you're listening from today and whatever you're doing, I thank you for giving me the gift of your time. Be sure to make AmericaOutloud.news your daily stop for all the latest news and happenings. We all must do our part and share the stories, the articles, the podcasts, and videos so we can help secure America's future. If you're just joining us, I am here with Nurse Jodi and with Nurse David, and we are answering your questions and comments as we do every Friday on this special Q&A episode. Let's jump right back in. So before we went to break, we had a question from Tim, and Tim was wanting to know, with so many conspiracy theories out there that somehow turned to reality, he is wanting to know, how do you discern truth from a true conspiracy theory? And David, we're going to let you roll with this.
All right, I'm excited about this one because this is something that I've spent a lot of time thinking about over the years, especially over the age of COVID. So like we talked about in the first half of the episode, we've seen these class action lawsuits around Vioxx and SSRIs and OxyContin and stuff like that. And what we've learned is that people in key leadership positions at these corporations will knowingly and intentionally kill people for profit. They will lie about fatal side effects. They will create fraudulent research to sell products and enrich shareholders. It is their business model. So the first lesson here is that corporations behave like psychopaths. Their death tolls rival wartime atrocities. Again, this is not, we discovered this side effect later. This is, they knew the whole time. They covered it up for as long as possible, and they killed people for profit by the tens of thousands, sometimes by the hundreds of thousands, sometimes by the millions. That doesn't mean that every single person working at Pfizer or wherever is evil, but again and again, people in key positions and the corporation in general exhibit psychopathic behavior. We've learned how they get away with it. They exert control over journals, academic institutions, and the news. We have an abysmal understanding of all this at a societal level, and even worse here within medicine itself. So we've learned that our federal regulators are varying degrees of complicit, incompetent, and/or impotent to stop these predatory behaviors. The FDA is an abject failure in its primary responsibility to protect the world from these corporations. Many of the lawsuits are settled under gag order, meaning wrongdoing is established in court despite these pharma companies having billion-dollar legal teams, but the public all too often doesn't get to know exactly what they did. That also means doctors don't get to know what they're up to, and patients definitely don't get to know. So the second lesson here is to never trust a lack of transparency. With any lack of transparency, assume the worst, whether it's the FDA, the CDC, Merck, Pfizer. If they won't release data, assume they're covering something up. Information redacted, assume the worst. If they're evading FOIA, assume the worst. You'll usually be right, unless you underestimate just how bad things can be. So the third lesson of all these lawsuits is that our judicial system is completely broken. And this one has important overlap with politics. If you think that the billions and billions of dollars in fines that pharma companies have faced in court means that the Justice Department is doing its job, it is not. We're talking millions of people killed for profit, and nobody has gone to prison. The people involved get to keep their money and their careers flourish. This is very similar to just like how in 2008, when the housing market bubble crashed, nobody went to prison. The corporations involved who set the whole thing up, they got bailed out. Wall Street got bailed out, and they got bailed out with our tax money. This was one of the biggest wealth transfers in history. Lives were completely ruined. There was all sorts of suicides and people who fell into addiction because this happened, and there was no real consequences for the people behind it and no regulatory change to make sure that things like that don't happen again. So pharma executives are protected. Wall Street executives are protected. They're protected after stealing billions of dollars from Americans. They're protected after committing mass murder, and they are protected after engaging in child sex trafficking, which brings us to Jeffrey Epstein, child sex trafficker for the rich, powerful, and influential, of which none have ever been brought to justice. So, for example, there's this executive at JP Morgan Chase. He sent Epstein an email while he was on Epstein Island, and Jeffrey Epstein was currently under house arrest for child sex trafficking. This guy who's working for this multi-billion-dollar bank that half of us have the name of it on a card in our wallet says, "Presently, I'm in the hot tub with a glass of white wine. This is an amazing place, truly amazing. Next time, we're here together. I owe you much, and I deeply appreciate our friendship. I have few so profound." They went on to exchange emails where they talk about Snow White, and apparently this JP Morgan Chase executive really liked Snow White, but he was kind of wondering, Epstein was wondering which princess he wanted to meet next time he goes to the island. So what happens to guys like this? We know his name. Where is he now? He's a millionaire. Is he in prison? No. How about the CEO of Merck from the Vioxx scandal? Is he in prison? No, he's on a board at Harvard today. The vice president of clinical research at Merck, who went to leadership there and said, I can design a clinical trial to hide the cardiac deaths. She's now the CEO of a different pharma company. The Sackler family of OxyContin infamy, they kept their billions of dollars. The leadership at Purdue exchanged emails. They exchanged poems making fun of the people dying in Appalachia of OxyContin overdoses. This is where J.D. Vance is from. And they were writing each other little ditties to the tune of the Beverly Hillbillies, except it was the Beverly Pillbillies, because that's what they called all the poor white people dying in Appalachia. So,
wow.
Regarding being a conspiracy theorist, the phrase to watch out for is "there's no evidence of that." Because that phrase doesn't mean it's not happening. What it often means is that we're hiding evidence of that. Vioxx causing heart attacks, there's no evidence for that. OxyContin causing addiction, there's no evidence for that. Zantac causing cancer, there's no evidence for that. Johnson & Johnson baby powder causing cancer, there's no evidence for that. They knew in the 70s about that. Zantac, they knew in the early 80s, and they kept those things out there for decades, knowing that they were causing cancer, and their public messaging was always, there's no evidence for that. SSRIs causing suicide, same thing. Vaccines, same thing. So when you hear there's no evidence of that, that should make that conspiratorial kind of a red flag go up for you. So when you follow these things closely, you really start to see a lot of the same names that keep popping up. So, for example, when Epstein killed himself, there was no reason to think that that was a suicide. There were so many things bizarre about that situation. There were the guards were supposedly asleep. The cameras weren't working. They didn't follow their protocols with collecting the body. There were controversial autopsy results. But the Attorney General of the US comes out and says there's no reason to think this wasn't a suicide. He had absolutely no reason to say that. So that was Bill Barr. Bill Barr appointed by Trump. So I use this lens to look at things with politics as well, right? So we have these things happening with pharma companies. We have these things happening with Jeffrey Epstein. So here we have Bill Barr saying, like, I don't care that the cameras weren't working or that all this other fishy stuff happened. There was nothing to see here. That's exactly what he said about the 2020 election, too. So I'm from Wisconsin here. Here's what happened in Wisconsin. We've got 5 million people here in Wisconsin. About 2 million of them voted back in 2020. Biden won by 20,000 votes. The drop boxes that were used throughout the state that year were deemed to be illegal after the election. 200,000 votes in Milwaukee alone happened by a drop box. So that's 10 times the margin of victory. There were rules put in place that those drop boxes were supposed to be under video surveillance. Guess how many out of the 15 had actually had video surveillance? Zero. None of them. Not a single one. Yeah.
Not one.
Not a single one. So there were also over 200,000 voters who circumvented voter ID laws that year because in the name of the pandemic, they were allowed to be considered indefinitely confined. Basically, they were allowed to call themselves disabled, even though they weren't disabled. And this was also deemed illegal after the election. This is over triple the number of people who are usually considered disabled at any given year in Wisconsin. So we also had Wisconsin election laws were broken in nursing homes under the premise of COVID. Observers weren't allowed inside to make sure that ballot harvesting wasn't happening. There was all sorts of weirdness going on in terms of voter turnout. Like they would notice that this apartment building has 95% voter turnout. This other one down the street has like 45-50%. Like that doesn't make any sense unless somebody went to this apartment building or somebody went to this nursing home and harvested ballots. That's the only reasonable way to explain when things like that happened. And we know because you can purchase people's cell phone location data that is harvested off your cell phone, that there were over 100 people who made an average of 26 Dropbox visits to those Dropboxes that just coincidentally didn't have cameras on them, just in the Milwaukee area alone. So when Bill Barr, who said there's no evidence that Jeffrey Epstein killed himself, comes out and says there's no evidence of anything funny going on with the election in Wisconsin, it's like, yeah, you know, I don't necessarily even need to see the evidence. I just need to see what he says about it to know that something fishy is going on. Like this is not a person who has any credibility. So in terms of conspiratorial thinking, when you see somebody who's a known liar telling you something, you just don't believe them. Like you lose your trust for them. Everything they says should be analyzed with suspicion from that point forward. Does that make sense to you guys?
It does. And, you know, just kind of off, not really off topic, but I'm just curious because you hit on this about the nursing homes. What are your thoughts on that? Because I had that happening, you know, at the local level, which apparently, you know, the election commission allows for the incumbent to go, just the incumbent, by the way, go into these nursing homes and campaign, if you will. And then they go in there like a day ahead of when early voting starts, an entire day ahead of when early voting starts. And they actually bring the machines in for them to vote. To me, and these types of facilities, this is predatory at best. What is your
It is predatory, yeah, because you want to ensure that these people have the right to vote. But in Wisconsin, we had instances of people who were 104 years old and thought that Gerald Ford was president. And
Right.
oh, lo and behold, they voted for Joe Biden. That's wild.
Right.
These people, they went to nursing homes full of people with advanced dementia, and oh, lo and behold, they all voted for Biden. Gosh, nothing to see here. This isn't suspicious at all. So it's yeah, I think it's pretty, honestly, I think it's overt and it's right in our face exactly what they're doing. I'll give another specific example, and I'll name somebody specifically. I already named Bill Barr. So Mark Elias, this have you guys heard of him?
I've heard the name, but that's not ringing.
It sounds kind of familiar.
All right, so this guy is a lawyer. He worked for both Hillary Clinton and the DNC back in 2016. He helped the DNC actively sabotage the Bernie Sanders campaign. The DNC wanted Hillary Clinton to be the nominee, so they made sure to undermine Bernie because Bernie was getting all this grassroots support. So this was all revealed by the emails that were released by Julian Assange of WikiLeaks. It showed them conspiring to anoint Hillary as a DNC nominee. Deborah Wasserman Schultz had to resign as head of the DNC, and then she immediately went to work for Hillary's campaign. Like, they're not even hiding the corruption. So this lawyer, Mark Elias of the law firm Perkins Coie, he got hired by Hillary, and he ended up instigating the entire Russiagate fraud. What he did was he had the Steele dossier fabricated. So he went to somebody and he hired them to write this fake dossier connecting Trump to Russia. Then he gave it to the FBI under the false pretense that I'm just a concerned citizen and I happen to get a hold of this. And don't worry that I work for Hillary Clinton. Don't worry that I work for the DNC. But you guys over at the FBI should take a look at this. And so the intelligence community analyzed it and they determined it was a fraud. So what did they do? Well, corrupt actors in the FBI went to a FISA court to obtain warrants to spy on Carter Page, one of the Trump staffers, and they just lied to the judge by omission and commission. They got FISA warrants to spy on Trump. Then they leak the fact that there was an open investigation into connections between Trump and Russia. They leak it to the New York Times, and then they use that news story to justify opening even more investigations. And then we have 3 years of his presidency being undermined by this fraudulent investigation. We had 3 years of Hillary and her allies all claiming the election was stolen. When it all came back to this lawyer working for Hillary, Mark Elias. This guy, Mark Elias, is in Wisconsin this year, making sure that the unmonitored election drop boxes are brought back in time for the 2024 presidential election. They're only doing this stuff in key swing states. So the Wisconsin Supreme Court flipped from Republican to Democrat in 2022, and all of a sudden we've got drop boxes back. And guess what? They don't have to have cameras on them this time. So when I look at all that, is that proof that cheating is going to happen in 2024? I don't have proof that cheating is going to happen, but I can see that they're planning to. Like, they wouldn't do this if they weren't planning to do widespread ballot harvesting again. Mark Elias, Hillary's lawyer, would not be waging lawfare in my home state of Wisconsin unless a key swing state, unless they were up to something like that. He wouldn't be spending his time here. So, yeah, is it conspiratorial? I mean, a whole lot of people would absolutely say it is, but when you dive in and you look at the details, you see the same names over and over. And if somebody has a non-nefarious reason why Hillary Clinton's lawyer is in Wisconsin making sure that drop boxes come back in 2024 when they don't have the COVID excuse anymore, I'd love to hear it. I'd love to hear a non-nefarious reason.
Well, I'm sure COVID's going to make a comeback. I mean, it's about that time, right?
Yeah, or bird flu, something like that. Yeah,
COVID. Yeah, something's coming. I mean, it's an election year. Buckle up. It's every 4 years. Every 4 years is something, whether it be, the Zika virus, the bird flu, COVID, Ebola, whatever it is. It's conveniently timed perfectly every 4 years. So,
So you can also apply this lens to medications too. Like this was very influential on me for how I looked at ivermectin, because we had people out there like Pierre Corey through the FLCCC and the Bird Group over in the UK, and they were saying like, hey, there are more and more studies coming in that say ivermectin works great. And then on the CDC website, we have 7 or 8 studies. I think it's 8 now that say ivermectin doesn't work. And so when you look at those studies, though, what you see is that they underdosed people. They started treatment late. They ended treatment early. They didn't dose to people's weight like they're supposed to. They changed study endpoints mid-study. They conducted these studies in countries where you could get ivermectin over the counter, which is a huge confounder. They also broke blinding. There was fraud in the enrollment process. And so I don't know whether or not ivermectin works based off of my independent analysis of all these studies have been published. But when I look at that set of behavior, what I can say about all these studies that were funded by Pfizer and funded by the Bill and Melinda Gates Foundation is that you have these names that keep coming up. You have these entities involved that have been convicted of fraud so many times. You have motive for them to commit fraud again, and then you see the behavior that they're engaging in where they're clearly trying to set up a negative study. I don't know whether or not ivermectin works, but I can tell you for a fact that they believe ivermectin works, because if they didn't, they wouldn't set these studies up like this. They would just let ivermectin fail on its own. The fact that they went through so much effort to set ivermectin up to fail means that they believe ivermectin works.
Right. And we saw so many, just anecdotally, we saw so many examples of it working. I'm one of them. I took it in 2 days. I was fine. Actually, we just passed my 2-year anniversary of my one and done with COVID. When I was at CPAC after 2 years of working in the ICU. It took me one 3-day conference at CPAC, and I ended up with COVID. And of course, Dr. McCullough was so kind to treat me and invite me into his home for my quarantine. What an incredible! I'll link to that story as well. How about that?
Yeah, they're up to over 100 studies at this point. Like the amount of overwhelming mountain of data that says that ivermectin is effective for COVID is it's irrefutable. So is that conspiratorial? Well, I guess it is if you believe everything the CDC says, but if you believe everything the CDC says, you haven't been paying attention, and you need to get your news from a different source.
Especially these days.
Yeah.
I mean, if we've just gone through the last 4 years and people are still taking their cues from the CDC and the FDA and all of these captured government agencies, I mean, they're just beyond hope, in my opinion. And I want to know who these people are with their Facebook profile frames that still say, I'm vaccinated.
Yeah.
We can do this. Like, who are these people?
Well, there's always going to be some percent of the population that's going to be willing to drink the Kool-Aid. And honestly, it can be really hard for some people to have their eyes open, because not only did they take these products, they gave these products to their children. And so the last thing that they want to do is believe that they did something to hurt themselves, or even worse, hurt their children. So there are some people who are going to cling to those blinders that they have on, that are going to maintain that cognitive dissonance. And there's no amount of data you can put in front of them that'll convince them otherwise, until something happens directly to them or to one of their kids. Maybe that'll wake them up. It does for some people, but for others, it's just it ain't going to happen. And there's no amount of facts that are going to dissuade them. They'll always cite authority. Well, the FDA says this and the CDC says that, and you're just some conspiracy theorist, so I'm going to keep believing what they tell me because it's way too uncomfortable to believe otherwise. And part of me really does empathize with that, because the nurse I was 10 years ago, I believed everything the FDA said and everything the CDC said and everything I read in journals and everything I read in my nursing textbooks. And I was a lot more comfortable feeling like, oh, we have these authorities out there who are compiling all the science that we can rely on for guidance. That was a safe world to live in, compared to having your eyes open to just how broken everything is. Do you guys feel that too?
Absolutely. I feel exactly
Oh
that.
yeah.
And it's like, because you can't, once you see it, you cannot unsee it. And I was like you, I was, every, year I'll get your flu shot, because I thought that that was what I was supposed to be doing as a nurse, to go out and protect patients, to protect the community. I'm out there, promoting the flu shot because I honestly believe that these people were doing their due diligence, or were testing for safety and all of that. Well, we now know none of that happens, and it's how just completely nefarious it is. But yeah, I was a lot more comfortable 10 years ago. Jodi, how about you?
Oh yeah, a lot more comfortable.
I was living my best life back then.
Right?
Yes, definitely. I remember, well, I like to say that, but actually, I'm a lot happier now, but, in some ways I'm not, for sure. I get it. We were more free spirited, and,
Not a care in the world.
you can actually have a conversation, and that doesn't involve like death and destruction all the time. It's like you can't even talk about the news without, because every part of our society is affected, every single part of it. So how do you have a conversation, like a normal conversation? When I was in Italy with Taylor, my daughter, and her friend, for almost 3 weeks, I was sitting there thinking like, oh my gosh, I haven't really talked about any of this stuff to them, because I was trying to keep it light. And I thought to myself, man, it's been 4 years since I've gone this long without, I touched, I didn't even tell you guys, we were sitting in Capri, in the middle of this town. Capri's a tiny island. And this lady comes up to me and she said, "Are you Jodi?"
Oh, no
And I said,
way.
"Yes." And she goes, "Oh my gosh, I follow you." This Italian woman with her kids.
That's
And
amazing.
Nice.
so that was cool. And my daughter and her friend was like, "Oh wow, you really have made an impact."
Yes.
And I was like, "Yeah, well, let's keep it light though."
Yeah, it never ceases to amaze me when I hear people talk about that they follow this. I'm like, oh, you listen? Like people actually listen.
Right. Yeah, it's so cool, especially when it's in front of your kid,
Yeah.
Yeah.
Yeah,
Because
that's an
how
awesome
our
experience,
family,
Jodi.
exactly. They're like, "Oh yeah, I know my mom did this. Yeah, I'm proud of her." Blah blah blah. But they don't understand the impact.
Mhm. Wow. Well, we unpacked a lot today. So thank you, Jodi. Thank you, David. We unpacked a lot. We covered a lot. So I appreciate, as always, your input today.
Yeah, it was great.
Answering these
Yeah, thank you.
questions. Absolutely. And that is all the time that we have for today, friends. But remember, we are here on the air 5 days a week, Monday through Friday at 10 a.m. Eastern. You can also catch the encore at 11 p.m. Eastern Standard Time. Please be sure to tune in and listen to myself and my amazing sister and brother, nurses, as we walk you through all of these hot topics. We will empower you with information and education. We will advocate and we will stand in the gap for you, because we are nurses and this is what we do. I'm your host, Nurse Kimberly Overton, and you can find me here every Wednesday morning at 10 a.m. Eastern. Until next time, be safe, be well, and God bless. Remember, we are in a war for truth. We are putting out a bounty on the real misinformation and exposing the purveyors of propaganda. No topic is off limits as we shine our lights and expose the darkness.
It's time